you. So we'd like to say thank you on behalf of 0 to 3 for the opportunity to be here with you today, to learn with you and from you, and to increase our opportunities for meaningful collaboration to advance our shared mission and goals. So thank you. Jodi and I are going to toggle back and forth. So 0 to 3, you see our mission up here. Since 1977, 0 to 3 has been translating research that helps us understand how our youngest children think and learn and interact with the important adults in their lives. We turn that scientific knowledge into helpful tools, services, and practical resources for parents, policymakers, and professionals like yourself to help ensure that each and every baby gets a strong start in life. At 0 to 3, we envision a society that has the knowledge and the will to support all infants and toddlers in reaching their full potential. Just to set the stage here for the urgency of in early care and education with our youngest children, we're sharing this quote here, which I'm not going to take part of our 7 minutes to read to you, though. But basically how urgent it is when every second matters and over 1 million neural connections are literally being made every second in our youngest children's brains. We are looking at a workforce population that is the most under-resourced, and that's in a field that's completely under-resourced, just to set the context. Jodi?
Thanks, Sarah. So we wanted to be able today to highlight 3 specific areas of work that we're doing that really looks at the collaboration between the health sector and the early care and education sector, as well as the variety of different professionals that are touching the lives of very young children and families. So as we move forward, we're going to kind of be specifically talking about these sectors that you see on this screen. And for those of you that are virtually logging on, you may not be able to see them as large. So this is obviously physical health, mental health, child welfare and social services, early identification and intervention, and early care and education. So I would like to highlight one program that we've been working with across sector, and this is our Knowledge and Know-How Nurturing Child Wellbeing. These are 8 online 1-hour lessons that have been coupled with communities of practice, and on this slide you can see our simple theory of change model. So what we really wanted to do was think about the integration of cross-sector professionals and think about integrating health, well-being, mental health, early intervention in being able to look at the opportunity to share language. And so we've seen some really nice knowledge gains as well as promotion of cross-sector collaboration, and ultimately looking at having increased support for families as well as optimal development for infants and toddlers, which we know then reduces the risk of child maltreatment. Another program we'd like to highlight is our prenatal to age 5 cross-sector core competencies that's been developed out of our Western office that was funded by First 5 LA. These consist of 8 competency areas, and if you look at the bottom rainbow structure, these are identified, and these 8 competency areas are early childhood development, family-centered practices, relationship-based practices, health and developmental protective and risk factors, cultural and linguistic responsiveness, leadership, professional ethics and practices, and service planning, coordination, and collaboration. In this cross-sector core competencies, again, we bring together these variety of professionals, including the health sector, that's touching the lives of very young children and families. And what these competencies are intended to do is really enhance that cross-collaboration, that shared language, and not to replace the professionals' existing discipline-specific competencies, because we know those are very important as well. So I'm going to now pass it to Sarah, and Sarah's going to speak to specialized infant toddler competencies for educators.
Thanks, Jodi. So as you see in the model that's up here on the slide, 0 to 3 has been working on what we call our critical competencies for infant toddler educators. They build off of this cross-sector collaborative foundation. We know that caring for infants and toddlers requires that holistic approach, and we also know that educators really play a key role in supporting and nurturing all aspects of infant toddler learning and development. So in the best case scenario, we have educators that partner with families, that partner with all of the sectors and disciplines to create that comprehensive environment that protects, that engages children, that provides challenge, that provides the nurturing learning and development and coordination. However, 0 to 3, after decades of looking across our partners, working with them, having requests across the nation and internationally, really felt that there were certain areas in pedagogy, on the interactions that happen on a daily basis for infants and toddler educators, that there was a huge gap. It was not existing. We had educators in the workforce going in and taking training really geared intentionally towards pre-K age, for example, and then coming back into their programs and being with a 6-month-old and not being clear about how do I then transfer this evidence base, that I know this interaction of back and forth is important in these areas, but unclear about how to do so. So that was really part of the intent of creating the critical competencies. There's specialized competencies, there's sector and discipline specific, role specific, age specific. Okay. Our approach in implementing these are multi-level. So we're supplementing and helping systems build on what they already have invested in the states. We don't have enough resources, as we said, in the field, so we wanted to build on that, not duplicate, and do so with our partners. So that's one piece of the systems. A second piece is we're building adult educators, professional development providers, capacity in this evidence-based, really specific infant-toddler pedagogy. Then the third piece is we're supporting individuals, those educators themselves, to reflect on and positively impact their concrete and daily practices with infants and toddlers. We're working right now, we are just completing pilots in 4 states and with 2 higher ed partners so far, the results of which are impacting over 60,000 infants and toddlers interactions on a daily basis in their early care and education programs. So it's a good start. We have a lot more to do together. I also wanted to share that we bring a diversity, fairness, and equity lens into each of the practices that are focused on in the critical competencies, not only for educators to work with a diverse population, but for the diverse educators that we have as well. Sometimes also we have a focus on the vulnerable populations within the critical competencies I wanted to highlight, and also working with multi-language learners. We have a lot of myths out there and misunderstandings about the strength base of the multi-language learners. It is something where we feel like we're doing myth busting and applying through concrete competencies. So sometimes children need more, though, than that skilled educator, even the most skilled educator, can provide. And back to Jodi's point about the cross-sector collaboration, we work and focus on how do we leverage and synergize the multidiscipline approach that we have to help educators connect in meaningful ways through concrete actions, through supports to families, through even, frankly, being familiar with a range of services, and to understand where their role can end and where their engagement with other partners starts. For example, identification of children early on who may need additional specialized services. And so the coordination with medical partners and even referring specialty evaluations for mental health. So that's all we have time to share about, but we thank you for that time to do so and look forward to the discussion.